Welcome to Healthcare Hoax. I'm Janet Cimorelli. I'm here with Dr. Herb Slavin, and we're talking this week about headaches, and today we're talking about the symptoms. Okay, so different people are going to have so many different symptoms. It could be a pounding sensation. It could be an achy sensation. It could be a stiff neck. It could be a variety of different manifestations that you are dealing with a headache. Dr. Slavin, when you speak to your patients, what are some of the symptoms they talk to you about?
Well, you mentioned, the different types of headaches. Constant pain, pounding pain, could be mild, could be severe, whether you're light sensitive at the time. Pain in the neck, it could be a tension headache. Location of the pain. It's on the side of your head in the temporal region. You can think of temporal arteritis, a serious condition. So it's, again, it's important to talk to the patient, and they usually tell you what's really wrong if you take the time to listen to what they say.
Okay, so you mentioned sensitivity to light. I know that sometimes a lot of people get changes in their vision, and is that a more serious situation?
Well, you're talking now, it sounds like, migraines, and the prodrome of a migraine is the type of symptoms people might get just before the migraine starts. It could be visual problems, olfactory, auditory, all
okay.
these,
all
prodromal.
senses.
Yeah.
Very interesting. Okay, what about when people are experiencing, as well as pain in their head, discomfort like that? What about when they have nausea? Does that focus in a particular direction?
It may. You see, is it the nausea causing the headache, or is the headache causing the nausea? So you have to, try and figure that one out. Is it food related? Are the headaches being brought on by some allergy? And that could be either a food allergy or a airborne allergy. So it's, again, asking the patient when they get the headache, what are they doing when they get it? Is it, after meals? The problem, though, is it may be related to food, but it could be the food you ate the day before, and then it becomes very difficult to connect the two.
What about when people are super fatigued? If they don't sleep well, might that be a trigger for headaches as well?
It could be, because lack of sleep is a trigger for a lot of things. It just weakens your body's own defenses to function properly. So it could increase the risk for a lot of things. They talk about now lack of sleep as being a risk factor for heart attacks. So you have to really pay attention and make sure you're getting enough sleep.
Okay, so is an underlying issue always inflammation for triggering a headache, or is there other issues in addition? Where does inflammation play a role with this?
I think the common pathway will be inflammation brought on by lack of sleep, food allergies, respiratory allergies, tension headaches. Maybe you're sitting at the desk all day and your posture is bad. That could trigger a headache. So there are a lot of causes of it, but the common pathway at the end is inflammation, and that's going to trigger the pain.
So if any of you have been dealing with headaches, if you have sensitivity to light, if you're experiencing a dull ache in your head, pounding pressure, any of those things, make sure to visit us again here on Healthcare Hoax Videos in order to address not only the causes, but some of the solutions to your issue with headaches. Remember, when you visit us at Healthcare Hoax Videos, please like us and share the video with your friends and family. Keep in mind that if you subscribe to Healthcare Hoax Videos, you'll get a notification when the next video is up. Make sure to visit us again.